A patient walked into my office last month, 47 years old, founder of a company, BMI of 25.8, perfectly normal by every standard measure. His doctor had cleared him 3 years in a row. His DEXA scan showed 31% body fat and visceral fat at nearly double the risk threshold for cardiovascular disease. His scale had been lying to him for years, and his doctor had no tools to see what I just showed him in 10 minutes. That's what we're covering today. I'm Dr. Trevor Turner, interventional sports and spine physician and the founder of Pravida Health in Atlanta. I run a DEXA body composition scan on every patient who joins my practice because I've learned that weight and BMI are almost useless as metabolic health markers, and the data backs that up completely. Today I'm going to walk you through exactly what a DEXA scan measures, what the clinical evidence says about why it matters, and what you should actually be tracking instead of your scale. If you want to understand your body composition and not just your weight, stay with me. Let's start with BMI. Body mass index was developed in the 1830s by a Belgian mathematician named Adolphe Quetelet. He was studying population statistics, not individual health. He never intended it to be a medical diagnostic tool, and yet here we are, in 2026, still using a 200-year-old population statistic to make individual clinical decisions. The fundamental problem with BMI is simple. It measures your mass relative to your height. That's it. It cannot distinguish fat from muscle. It cannot see where your fat is located. It tells you nothing about visceral fat, the metabolically dangerous fat around your organs, and it completely misses sarcopenia, the loss of muscle mass that predicts frailty, falls, and early death. A 2023 study in the Journal of Family and Community Medicine scanned 319 adults with DEXA and compared results to BMI. BMI classified 51% as obese. DEXA found 92% had excess body fat. 40% of people BMI labeled as normal were actually obese by objective measurement. Those aren't the same number. And the difference isn't trivial. It's the difference between being told you're fine and being told you have a serious metabolic problem that needs attention. The same thing happens in reverse. I have patients with BMIs of 28 who are athletes, high muscle mass, low visceral fat, metabolically excellent. BMI calls them overweight. DEXA tells the truth. So what does a DEXA scan actually give you? 3 compartments: fat mass, lean mass, which includes muscle and organs, and bone, in about 10 minutes, with less radiation than a day's worth of background exposure. But the clinically critical outputs are 2 specific numbers. Number 1, visceral adipose tissue, VAT. This is the fat packed between your organs, your liver, pancreas, intestines. Unlike subcutaneous fat, the fat under your skin, visceral fat is metabolically active. It releases inflammatory proteins called cytokines, disrupts insulin signaling, and drives cardiovascular disease and type 2 diabetes. The research is unambiguous here. A 2025 meta-analysis found that high visceral fat was associated with a 55% increased risk of cardiovascular disease, and each half-unit increase in the visceral adiposity index raised cardiovascular death risk by 19%. 19% per half unit. Linear dose response. No safe plateau. Healthy VAT area on a DEXA scan. Below 100 centimeters squared. Above 160 centimeters squared. Significantly elevated risk. And here's the critical part. You cannot reliably estimate visceral fat from waist circumference alone. 2 people with the same waist measurement can have completely different VAT levels. Number 2, appendicular lean mass, ALM. This is the total lean tissue in your arms and legs. It is the best available proxy for your functional muscle reserve. We normalize it to BMI, what's called the ALM-BMI ratio, and compare it to age and sex-specific normative data. Why does it matter? Because sarcopenia, the loss of that lean mass, kills people quietly. A 2025 study followed adults with cardiovascular disease who had DEXA scans. Sarcopenia was present in 37% of patients. But here's the number I want you to pay attention to. Patients who had both high fat and low muscle simultaneously, sarcopenic obesity, had a 6.74-fold increased risk of cardiovascular death or major cardiac event, 6.74 times, and most of those patients had normal BMI. Your scale would have told every one of them they were fine. In my practice, I use DEXA as the foundation of metabolic assessment for every patient. Here's why. Body composition doesn't exist in isolation. I had a 52-year-old CEO come in last year. Energy tanked, strength declining, a belly that had appeared over 3 years despite eating the same. His primary care doctor's note said, metabolically healthy, BMI normal, His DEXA, 28% body fat, VA of 178 centimeters squared, ALMBMI in the lowest quartile for men his age. His fasting insulin 18 micro IU/ml, insulin resistant confirmed by HOMA IR of 3.8. His free testosterone 6.2 picograms ml, low end of normal but functionally low given his symptoms. All three pieces of data told the same story: metabolic dysfunction that his BMI couldn't see. We built an intervention plan around all three pillars simultaneously, not a generic eat less, move more recommendation. 6 months later, VAT dropped to 121 centimeters squared, ALMBMI improved significantly, fasting insulin normalized to 7.2 micro IU/ml. He felt like a different person. That's what precision data does. It makes the invisible visible, so your interventions can be targeted, not generic. At Pravida Health, every foundation membership includes baseline DEXA body composition as part of our initial comprehensive assessment. We reassess every 6 to 12 months to track change, not just on the scale, but in the compartments that actually predict long-term health. If you've been tracking your health with a bathroom scale and your doctor's yearly "you're fine," I'd encourage you to ask for more. Ask what your visceral fat level is. Ask what your muscle mass looks like for your age. Ask for the data that actually tells you something clinically meaningful. If you're in the Atlanta area and want to learn more about our foundation membership, which includes DEXA body composition, comprehensive lab work, and a full metabolic assessment, the link to schedule a consultation is in the description below.